The ability for doctors to have an injectable way of restoring soft tissues has many, many applications. Of course, breast cancer reconstruction comes to mind, but we can also use this for reconstruction after removal of tumors anywhere in the body. We can also use this for reconstruction after trauma, for example, in our wounded military personnel. And right here at UPMC and the University of Pittsburgh School of Medicine, we are performing clinical trials where we're using this exact same therapy. The authors of the study explored a way to take a patient's own stem cells from their fat and add them in to other fat tissue so that we have a graft material that's very rich in cells. It's very abundant in these very bioactive stem cells, these cells that have a healing capability, so they can enhance the healing process and get better tissue long-term with the healing. One of the great things about this work is that the scientists doing this experiment used stem cells that are derived from our own fat tissue, not embryonic stem cells that have ethical issues, but these are stem cells that reside within our own fat tissue. We're all carrying them around every day. They're easy to get at. The work that was published in The Lancet is so important because it really shows how we're developing new technologies, new therapies to reconstruct damaged tissues in a more minimally invasive fashion using stem cells from our own body. And we really want people to know that we've been working with the same technology here at UPMC for many years, and we have clinical trials going on right now using the same stem cell technology for facial reconstruction after trauma and for reconstructing limbs, especially limbs that have been injured and where patients have had amputations, using this exact same technology. These are procedures that are available to patients right now through different clinical trials. Again, it's still in the experimental range, so it's not something that we're ready to offer commonly in our practices or that's necessarily an established method of performing breast reconstruction or any kind of reconstructive surgery. So we're very happy to see this being investigated in human clinical trials. Time will tell as to how this will become integrated into our practices. The real take-home message here is that we are actively exploring methods to reconstruct damaged tissues with minimally invasive means by using a patient's own fat cells. And this has the potential to replace a lot of therapies that we are now doing with implants or with more major surgical procedures to achieve those same results. We may be able to do this in a less invasive manner and with a faster recovery and potentially with better outcomes.